Hello and welcome to this educational video about gastritis. I'm Dr. Motahare, and in this video we will explore what gastritis is, the different types, key causes, especially the role of H. pylori, Helicobacter pylori, and the latest evidence-based diagnostic tools, treatments, and preventive strategies. All information is aligned with the latest global clinical guidelines, including those from American College of Gastroenterology. Let's get started. Gastritis refers to inflammation of stomach mucosal lining. It can be acute, sudden, and short-lived, or chronic, developing slowly over time. Inflammation can be caused by infections, chemical injury, autoimmune disorders, and even stress. Gastritis can be symptomatic or silent, and sometimes can only be diagnosed through endoscopy and biopsy. Gastritis can be classified based on the duration, cause, or appearance. It's broadly divided into acute gastritis and chronic gastritis. Etiological classifications include autoimmune gastritis, where the immune system targets some special cells in the stomach wall that leads to some kind of anemia too. Infectious gastritis, most commonly Helicobacter pylori infection, but other bacterial infection and a viral infection can cause infectious gastritis too. And also gastritis secondary to other systemic illnesses like inflammatory bowel disease. There are also some external factors that can lead to gastritis, like alcohol abuse, smoking, radiation, or some kind of a special diet, some kind of health habits. There are some other kinds of gastritis like allergic gastritis or biliary reflux gastritis. The other important classification is by endoscopy and histological evaluation under the microscope. That is very important in subclassification, diagnosis, and treatment. Gastritis has multiple potential causes. The first one is excess acid production, like consuming spicy fatty foods or acidic foods, along with excessive alcohol abuse, or excessive caffeine intake. All can trigger increased acid production. In addition, emotional or nervous stresses can also directly impact digestive function and increase acid secretion. The other etiology is H. pylori infection, the most common cause globally. The other one is a long-term use of some medications like NSAID, such as ibuprofen, which reduce the protective mechanisms of gastric against acid that can lead to gastritis. Other ones is excessive alcohol abuse, which again disrupt the mucosal barrier. Smoking is an important factor too. Smoking, the nicotine in the smokes can weaken the lower esophageal sphincter, making it easier for stomach acid to reflux into esophagus. The other one is autoimmune mechanisms, often lead to other autoimmune disease. The next one is radiation. Some people just get radiation because of some other problem, and the result is gastritis. Or bile reflux. In some cases, the bile that is from small intestine reflux to the stomach and lead to bile reflux. Also, something else, irregular eating habits. Skipping meals or eating irregular times can also disrupt normal digestive process. The other one is a lack of sleep. Sleep deprivation can affect digestive function and potentially lead to increased acidity. For diagnosing the cause of gastritis, we need to evaluate completely some parameters. The first one is patient's age, symptoms, other symptoms like presence of vomiting, nausea, or weight loss, night sweat, other things like that. A true medical and drug history, any previous medical condition, and also a diagnostic set of tests. Age plays a key role here because new onset symptoms in an older adult warrant extra caution because in this age group, maybe this new onset dyspepsia is the sign of more serious problem like gastric ulcers or cancer. Younger patients are more likely to have H. pylori associated gastritis. We should ask for key risk factors including NSAID or corticosteroid use. These drugs, alcohol consumption, smoking, and the level of patient's stress. The pain pattern is also very important. Gastric ulcers typically cause pain during or shortly after meals and may be associated with weight loss. Otherwise, the duodenal ulcers often present with pain a few hours after eating or at night. And also, when we eat, eating may relieve the pain. Okay. To detect H. pylori, there are a set of tests that I will discuss them later. In persistent, atypical, or high-risk cases, we may need upper endoscopy with biopsy to address mucosal damages, detect H. pylori, and rule out malignancy. A comprehensive clinical and diagnostic approach ensures accurate identification of underlying cause and guides effective treatment. Let's talk about H. pylori infection. H. pylori is a gram-negative spiral bacterium that colonizes in the gastric epithelium. It's highly prevalent in many regions and it's a major cause of chronic gastritis, peptic ulcer, gastric cancer, and multiple lymphoma. H. pylori infection can persist for decades if untreated and is confirmed through a set of non-invasive tests or endoscopy with biopsy. H. pylori is primarily transmitted through the oral-oral or fecal-oral routes, often due to poor hygiene or contaminated food and water. One significant but often overlooked risk factor is frequent dining out, especially in places with inadequate food safety or sanitation practices. Share plates, spoons like that, unwashed hands for food handling, and improper cleaning of vegetables or dishes can all contribute to the spread of these bacteria. To reduce this risk, it's important to choose restaurants with good hygiene standards and to practice proper hand washing and safe eating habits, especially in high-risk regions. H. pylori can be diagnosed using several methods, each with varying accuracy. The urea breath test is considered the most accurate non-invasive test, very sensitive and specific. It's ideal for both diagnosis and post-treatment confirmation. You will take a simple capsule in the lab, and after a few minutes, you will breathe in a special kit, and the machine will tell you if you have bacteria or not. There is just a point here in pregnant women, it's better to use carbon 13 instead of 14 because carbon 14 is radioactive. The other very good, very helpful test is a stool antigen test. Sensitive, specific, very good. And also it's very good for initial testing and follow-up. The other test that is used so frequently is serologic test, antibody test. This test is widely available and everyone uses this, but it cannot distinguish between active and past infection, because as this bacteria enters the body and the immune system responds to that, the antibodies may remain in the body for a long time. So the serologic tests are not appropriate, not for diagnosis, not for confirmation of treatment. And the gold standard, the best one is endoscopic with biopsy, which is an invasive test. We just save this option for a special occasion. In this case, with an endoscopy, we just take some sample and send it to the lab. We can visualize the bacteria under the microscope, and also we can use a urea rapid test to understand if there is this bacteria in that specimen or not. But we save this option when there is other possibilities too. When we are looking for something else, there's alarming symptoms. For example, patients had weight loss, patients had severe pain, unresponsive to treatment, older age, or cachexia, all of them. If there is alarm symptoms, we think maybe this is something more serious. In this condition, we'll do endoscopy and take a sample, and beside doing our main purpose, we will test for H. pylori too. Managing gastritis depends on underlying cause, but generally focuses on relieving symptoms, healing the stomach lining, and preventing complications. When gastritis is caused by H. pylori, the main treatment is a combination of antibiotics and proton pump inhibitors, PPI, for about 10 to 14 days to eradicate the bacteria and promote healing. For gastritis caused by irritation, such as NSAIDs use, alcohol abuse, or smoking, the first step is to stop or reduce exposure to these triggers. Acid suppression with PPI or H2 blockers helps decrease stomach acid, which eases symptoms and allows gastric mucosa to heal. In cases of autoimmune or atrophic gastritis, vitamin B12 supplementation may be necessary, because these conditions can impair the absorption of vitamin B12, leading to anemia and lots of neurological issues. Additionally, medications like sucralfate may be used to protect the stomach lining for chemical or NSAID-induced gastritis. Lifestyle changes, such as avoid spicy or acidic foods, eating a smaller portion of meals in each time that we eat, not a lot of food in each time, each meal. Each meal a smaller portion, and staying hydrated all support recovery. In chronic gastritis, especially atrophic ones, regular follow-up is needed to monitor for potential complications like ulcers or increased risk of gastric cancer. Overall, effective management combines targeted medical treatment with lifestyle adjustments to improve symptoms and promote long-term gastric health. For prevention, effective preventive strategies include avoid NSAIDs unless absolutely necessary. NSAID is a kind of pain reliever. And using gastroprotective agents like PPI when indicated. For example, there is a kind of inflammatory condition like gout or any other disease that needs high dose of NSAID. At the same time, we will prescribe PPI-2 to protect the lining of the stomach. Limit alcohol and smoking. Maintain good hygiene and food safety to reduce H. pylori risk. Screen and test for H. pylori in high-risk populations. Balanced diet, low in salt and rich in fiber. Stress management is also important to reduce acid overproduction and functional dyspepsia. Thank you for watching this video on gastritis. I hope it helped clarify this important condition and its management. Don't forget to like, comment, and subscribe for more videos. If you have questions, drop them below. I'll be happy to answer. Stay informed, stay